Um, how many of these patients do you feel like really should be going to like an urgent care versus an
Mm.
emergency care situation?
Yeah, I think that's a great question. I think that there are, pretty much anyone that's weight bearing, I usually associate with more of an urgent care
Hmm.
status, but it's also tricky because we have people who hurt their knee the day before and came back the next day, and turns out they had a tibial plateau fracture and they were,
Walking
doing their
on it.
best. Yeah. And so it's hard
Yeah.
because I know, I do the blog post for the EDDPT, and I just went over Ottawa knee rules. And there's times where it's like, man, but I've seen people walk on their fracture and it's not great. And so
Yeah.
how do you, everyone pretty much gets an x-ray. We're here as long as it's clinically indicated, and the attendings are always involved in that. But yeah, I will say that there are a lot of people that could go to urgent care instead, but we
Mhm.
actually, Vail Health has created a whole streamlined process of um, when ski patrol brings you down the mountain, you either will be in an ambulance because medically you need one, or you go into a ski transporter van, which is a complimentary service of the hospital. And so if you dislocate your shoulder, if you hurt your knee, you there are ski transporters that will. They're very fancy vans, very cool gurney beds where you don't even have to do any lifting. It's all automated and remote controlled. And then you basically get brought into the emergency room. So really part of it is, even though maybe some people could go to urgent care, a lot of Vail Health is actually built to absorb
To
all of
kind
these.
of serve that patient population is fulfilling.
Exactly.